Good afternoon. We are here for the In Conversation with Night session with our expert in sonography. So I'm asking him a few questions that he's supposed to answer in 30-40 seconds of interval. So very quick fire. The first question is, do you exclusively identify with one kingdom or more?
So one day a week I do scanning, one day a week I do IVF, one day a week surgery. So the answer is no.
It's the perfect example of synthesis.
A third, yeah.
Okay, okay. And what is among these? I don't know. We have heard you in the ultrasound session, so I can assume that you identify yourself mostly with the sonography kingdom. So considering this viewpoint, the question is, what is the strongest weapon belonging to the kingdom you identify mostly with?
The strongest weapon? So detailed ultrasound scan from the whole kingdoms, whether it's hysteroscopy or IVF lab, for me it's always ultrasound. Because I think the heart of the IVF and fertility unit is ultrasound.
Okay. So in the infertile patient workup, considering the latest recommendations, if you could make an update or modifications in those recommendations, what would it be?
So in terms of update, it wouldn't be so much in recommendations. I think it would be more on technology. I would like the industry to create automated measurements for fertility patients, whether it's the uterus or the ovaries and the follicles. And I think with artificial intelligence is going to come in a few years. And then recommendations can be made using big data.
Okay, thank you. Next question is, what is your unpopular opinion among other knights in your kingdom regarding the infertile patient management?
Okay, so it's not so much my personal opinion, I guess, but in certain healthcare settings like the UK, access to hysteroscopy is not as easy as we would like. So that's often very unpopular in settings where outpatient hysteroscopy is as easy as a cup of coffee.
Exactly.
And I think that's very unpopular, but it's not a personal opinion of mine. It's the restrictions of the healthcare systems that don't allow easy access, but it's up to us to change them.
Very diplomatic answer.
Well, you have to try. Keep all the kingdoms happy.
Thank you, perfect. And so I try with another quite provocative question. What is the most medieval practice in the kingdom you belong to regarding the infertile patient management?
I think it's the same, avoiding endoscopy.
Okay.
So just trying to do everything with scan, avoiding MRI, basically not asking for help. Okay. So you should always ask help from the other kingdoms, I think is the best take-home message.
Thank you, perfect. And so considering the three kingdoms, for the purpose of the final win, that is reaching the reproductive outcome for the patient, which one of the other two kingdoms has the strongest power as an alliance?
The strongest kingdom of all is probably the lab, So in the IVF side, if you don't have a good embryo, it doesn't matter how good you operate or how good your scanning skills is, you will not have a baby. Okay. So that is the limiting factor always. So if I had to choose good surgery, good scanning or good embryo, I would always choose good embryo. Perfect,
excellent. And the last question is, if you could duel with only one knight, who would he or she be?
So I think again the embryologists, I work in IVF and I know how important the lab is. Everything starts and ends there. So I would put always the embryology first.
Okay, thank you very much. This is it.
Thank you.